Yeah, well, thank you to everyone for joining us tonight. I was actually due to deliver an ultrasound training day for a practice in Bristol today, but needless to say, COVID-19 put a stop to that, and also all the other in-house training courses that I've had planned for the year. So plan B, here I am delivering a webinar instead. I must admit, the talk that I actually gave 2 weeks ago was my first ever webinar, and it was quite a weird experience. I'm actually used to talking to an audience in the traditional way and not sitting in an empty office at home speaking to a laptop. So anyway, tonight's talk is going to focus on practical ultrasound of the bladder. I've actually shaved it down a little bit, so it's not as long as the talk that we did 2 weeks ago. It's more of a bite-sized thing. So I hope you all find it useful. So here we go, practical ultrasound of the bladder. So my starting point is my tip of the day, same as I did 2 weeks ago. And that is to never ever perform a lone bladder scan. So when someone in the practice comes up to you and says, "Hey Mark, could you just scan this dog's bladder for me?" And you politely say, "I'll do a full abdominal ultrasound scan," because I think if you get into the habit of just scanning one organ, you're going to miss things and it will eventually come back to bite you. So that's my starting point. That's my tip of the day. So I think for the start of this, I know we talked about knobology and driving your ultrasound machine last time 2 weeks ago. I'll just quickly go over this again because I think it's really important. So your starting point is to press the abdominal preset. So that's the one that says abdomen here, not cardiac. If you select a cardiac setting, it won't be optimized for looking at the bladder. So press your abdominal preset. And then think about the 4 magic buttons. These are the buttons that I would say that are most used throughout a full abdominal ultrasound scan. And these are the depth, which is the number of centimeters that you're penetrating into the tissues. Gain, which is how bright your screen is. Time gain compensation, and we talked about these 2 weeks ago, and I'll talk about that again. And the last one, focus. So that's your 4 magic buttons. In addition to the 4 magic buttons, I think it's worthwhile also thinking about the frequency that your probe is running at. So just remember that a lower frequency, if you select a lower frequency range, that will give you good penetration. If you select high frequency range, that will give you good resolution. So you need to think about that as you're doing your bladder scan. And then when you're making minor adjustments, it's quite nice to alter the dynamic range or the compression. So if you're using a higher dynamic range, like the image on the left here, you can see a left adrenal gland, and what you can see is you get finer grayscale detail, whereas with a lower dynamic range, what you get is a more contrasty image. So the black is blacker and the white is whiter. So you're looking for something like the image on the left to really optimize your view. And then there's this button. I love this button, which you find in a lot of ultrasound machines these days, and this is the zoom. So once you find an area of interest, it's great to just zoom in to that area so that you can see things in a bit more detail. So that's zoom as well. So onto the bladder. If I was doing a bladder scan, the bladder wants to be full as your starting point. If your dog comes into the room, looks at you and wheezes on the floor, then I guess it's going to be more difficult to see what's going on in the bladder. So ideally your bladder wants to be full, and there are some techniques that you can use to ensure that the bladder is full. You can give the dog a drink of water before you start, or you could put the dog on some IV fluids, or you could catheterize the dog and flush in some saline so that you can distend the bladder and really evaluate it fully. And then your bladder scan can be done standing, or it can be done in dorsal recumbency or left recumbency, left lateral or right lateral recumbency, or any combination of these, so that you see the whole bladder from 360 degrees. And what I would suggest that you do is you scan in both the longitudinal and the transverse planes. And don't forget, the bladder isn't just the body of the bladder. There's a neck, and you should always scan right up into the bladder neck and as far as you can go into the urethra. It takes a bit of hand-eye coordination to do that, but as you get better and better at it, you can actually, you'd be surprised how far that you can see into the pelvis. And then part of my bladder scan would also check the draining lymph nodes, the local lymph nodes that drain the bladder. So what about the technique? For the long axis, whoops, just gone one forward. So for the long axis, this would be my starting point. And hopefully you can all see my, my pointer here. But if we look at the image in the middle, what I have is the probe facing in the long axis. So the actual button is facing to the cranial part of the dog, and I'm slicing in a long axis. So that's your starting point. And to scan the body of the bladder, I would fan up to the left of the bladder and go right off the end of it so you don't miss anything. And then fan down to the right so that you see the right side of the bladder as well. So that's your fan up and down, and from that middle starting point. And then in terms of your image optimization, so this would be your starting point. This is a long axis of the bladder. Cranial is to my left, caudal is to my right, so the bladder neck is going to be to the right. So thinking about the 4 magic buttons, what I would want to do first and foremost is alter the depth so that the bladder is occupying about 3/4 of the screen. We want to think about where the focal position is, and the focal position for scanning the bladder wants to be in line with either the distal wall or the proximal wall. There's no point in having your focus in the middle if there's nothing there but urine. So just think about where you put that focal position, because that makes a huge difference to the quality of the images that you get. And the bladder is one where the time gain compensation comes into play as well, because what you find quite often is that this the near field of the bladder is quite often very bright, and so you use your time gain compensation to reduce the gain in the near field. And I would also quite often find that you get acoustic enhancement artifact or acoustic enhancement in the far field. And if it's too bright, then you can just take that down, take the gain down in the far field of your screen. And that really gets you a nice image of the bladder. And then the last thing to think about is the frequency that you're running the probe at. So we're, what, 5-6 centimeters depth, and we're running at a middling frequency. That's okay for this, I would say. So once you've done the long axis, what I would then do is rotate the probe 90 degrees. So the button is now facing towards the dog's spine. So this is a short axis view. And what you want to do then is fan cranially, and you fan all the way until you go off the end of the bladder, and then fan caudally, and you want to fan all the way right up into the neck until you can't see any more of the bladder. And then the last bit, and this is where it takes a bit of hand-eye coordination, is to scan right up towards the pelvic inlet. And what you're attempting to do is go right into the neck and as far into the urethra as you can possibly go. And as you go, just think about altering your depth again. So to go into this dog's bladder, neck and urethra, I'm now scanning at 2 centimeters depth. I've got my focal point roughly where I want, in line with where I want it to be. My frequency, okay, I could probably have made that a bit better. I could have increased the frequency because we're only scanning at 2 centimeters depth, so we could have improved the resolution a little bit more there as well. And then your zoom will blow things up even better. So that would be the technique for scanning the bladder, neck and the urethra. And I always say the final part of doing a bladder scan, or an examination of the bladder at least, is a rectal exam. And the reason that I say that is that, for example, if I was scanning a dog that is got hematuria, it's possible that the source of the bleeding is not just quite in the bladder neck, but it could be in the pelvis. And sometimes you can pick up pelvic masses, vaginal masses, urethral masses just by doing a rectal exam. So don't forget that, it's a really useful thing to do. And then I like to look at the draining lymph nodes. So the medial iliac lymph nodes are the draining lymph nodes for the bladder. And where do you find the medial iliac lymph nodes? You tend to find them at the aortic trifurcation. So in terms of getting your landmarks for that, this is how I find the medial iliac lymph nodes. I look for the aorta, and again, a bit of hand-eye coordination so that you can get a nice longitudinal view of the aorta, and you're looking for the aortic trifurcation. You can only see 2 branches of that here, but what you find is the medial iliac lymph nodes tend to be clustered around here, or here, or here. Okay, so here's an example of a dog with enlarged medial iliac lymph nodes. So here you can see the aorta, caudal vena cava is below, and you get 2 golf ball-like structures that are just at the aortic trifurcation there. So these are hugely enlarged medial iliac lymph nodes. So what about pitfalls and artifacts with the bladder? I think it's important to realise that normal urine is normally anechoic, so it's very black. But sometimes you'll find that you get urine that's very echogenic, as if there's a lot of debris sitting within the bladder. But that finding is not specific for a urinary tract infection. So just be aware of that. Another artifact to be aware of is pseudo-sludge. So this is not true sludge. The arrows are pointing to what looks like some sludge at the bottom of the bladder. And in actual fact, this is an artifact that's created by something called side lobe artifact. And what you can do if you get this, you can fiddle with the gain. Sometimes you can fiddle with tissue harmonic imaging to try and take that down. And if you're not sure whether this is pseudo sludge or whether it's real sludge, always remember that if you've got real sludge, it's going to fall to the dependent part of the bladder that you're scanning. So if you're scanning down towards the floor and it's at the floor, then it's more likely that you've got true sludge there. And other things that you can do that's helpful, you can blot the bladder to see whether any of that moves or not. And if it's just an artifact, then you're not going to see any change to that. Also be aware that as the bladder muscle, or as the bladder empties, the bladder muscle recoils and it becomes artificially thickened. So I would always beware of over-diagnosing a thickened bladder wall when the bladder is actually emptied. There are some thicknesses that are given for cats. So cats' bladder wall thickness ranges from 1.3 millimeters to 1.7 millimeters. And in dogs, if you look at the textbooks, this is Atlas of Small Animal Ultrasonography. There's a suggested mean thickness depending on the degree of distension of the bladder with urine. So it just gives you an idea of where you should be roughly with bladder wall thickness. Other things to be aware of is adjacent structures to the bladder. So this is my dog Nell this morning, I think it was. Maybe it wasn't this morning. Anyway, so Nell has got some poo in the colon. And as that is sitting against the bladder, it's causing a dent in the bladder wall. So that's not actually within the bladder that you can see that there. That is the colon sitting against the bladder. So just be aware that you could be wrong-footed with a case like this. The way around it is to sweep back and forth across the area of interest, rotate your probe 90 degrees and see if you can see the same thing at 90 degrees, and quite often you can then get an appreciation of what actually is within the bladder or whether it's something sitting up against it. So that's a basic ultrasound technique. Other things that you might see adjacent to the bladder, this pumping structure here is the aorta. So quite often the aorta sits quite close to the bladder. If you think about the anatomy, it makes sense that if you're scanning the bladder, you'll probably see the aorta as well. Yeah, this is my dog. You can actually see her cervix in this. So this is using a lovely linear probe. It's a high frequency probe. So you're seeing lots of fine detail, beautiful image. So this is Nell's bladder neck, and you can actually see some of the cervix. That's not a structure that you would see commonly, but as you get really good at doing abdominal ultrasonography, you start to see structures in a bit more detail. And other interesting things to see, useful things to find, you can quite often line up with the ureteral papilla. So that's where the ureter enters the bladder. There's a little notch that you can see, and that's the ureteral papilla. Why is that important? Well, you can actually use that to localize ureteral jets, so you can confirm flow, and it also helps to confirm anatomically where the trigone is if you've got lesions. So this is a useful thing to do. So what I've done here is just popped a colour flow box across the ureteral papilla and just waited and waited and waited, and then you can see a little jet there. So I've pressed pause, replayed it back, and just spliced or trimmed the video and played it back quickly so that you can see it. So this isn't real time that you can see. This is for demonstration. You can actually sometimes see ureteral jets just using your black and white imaging as well. And it's more obvious in a dog that's just had a drink of water. And if there's a difference in the specific gravity between what's entering the bladder and what's already in the bladder, then it allows you to see that easier as well. It's quite cool when you do see it. So here's some clinical cases. This just demonstrates the importance of looking at the bladder neck and assessing the whole of the bladder. So what you can see is some sort of mass that is expanding close to the bladder neck. Here's another one. So here's the body of the bladder on the left and the neck of the bladder to the right. And what you can see is me putting a catheter in and out over that area. So this was an animal that was having difficulty peeing. And I was actually surprised how easy it was to pass a catheter through that. I thought I would have real difficulty passing a catheter through that. But where this is useful is for actually sampling and getting cells to send off to the pathologist, because you can use ultrasound to accurately line up the tip of the catheter so that you can take samples of that. And I'll show you that in some images in a minute. So what else do we see in the bladder? Bladder calculi. So what I would be looking for with bladder calculi is the hyperechoic mineral density signal. So that bright white echo that you've got here. And if it's a mineral density, I would expect to see this shadowing artifact beyond that. Don't take any notice of the bladder, all this white in the bladder. This is me previous to taking this video. I've just flushed some saline into the bladder, and so this is some bubbles that are just sitting in there. So if you're not sure as to whether you've got a stone or what it is, it's quite useful to catheterize the bladder and scan while you flush some saline in. So this is what happens if you're not sure and you flush some saline in. See that? We'll just wait for it to do the same again. Yeah. What you're seeing there is a stone that's being blown away up into the bladder, and gravity is making it drop back down again. That's a useful technique if you're not sure about what you're seeing, if you're not confident. Really simple thing to do. Here's another one. This is a much bigger stone that you can see. As I flush the saline in, you can see the stone just rolls over onto its side. So it's a useful thing to do for stones. It's also a useful thing to do where you may not be sure whether you've got just a clot in the bladder or whether you've got actually a soft tissue density or a soft tissue mass that's attached to the bladder wall. A clot you would expect to float freely in the bladder as you flush saline over it. A mass you wouldn't expect to move at all. And here's another image, just a bit more spectacular, of a calculus in the bladder. So hyperechoic signal, and a strong shadowing artifact beyond that. And we see various versions of that in dogs and cats commonly. If you look even closer, so this is scanning right up into the bladder neck. This poor dog has actually got a calculus stuck in the prostate. So this is why I bang on about scanning right into the bladder neck as far as possible, and even into the urethra. So this is the prostatic urethra with a calculus in here. And this dog actually scanned his penile urethra as well, and he was all clogged up with stones, multiple stones along his penile urethra too. And this is typical. This is a photograph from years and years and years ago. This is the stones that I took out of one single dog's bladder. And this dog, when you actually palpated his bladder, you could actually hear these stones and feel them knocking against each other. It's quite spectacular. So here's another case. So this is an image that was captured a number of years ago. So the actual quality of the video is not that great, but you get the idea as to what's going on. So here's the bladder, here's the bladder neck, and there's a mass that you can see at the bladder neck. So here's the video. So you can see quite clearly the wall of the bladder is disrupted by the mass. So my next question was, well, where is that? How far into the neck is that? How close is that to the trigone? How close is that to the ureters? Is that something that's going to be surgically accessible? Because that's important from a planning point of view. So again, what we did here was we popped a colour box across and just waited. And as you can see, there's a ureteral jet, and the mass is located right in the middle of this ureter. By the way, that's the catheter that you can see there. So that wasn't good for this case in terms of what we could offer surgically, and the owner decided not to go ahead with any surgery on this at all. We got some cells off it, and it came back as a transitional cell carcinoma, and we did that by suction with a catheter. And this was the same dog 6 months later, so things had progressed quite dramatically, and she was in trouble at this point here. She was squatting to pee all the time and really in quite a lot of discomfort. Another thing that people, I've struggled with in the past is, do I actually have a soft tissue mass within the bladder, or do I have a blood clot floating freely in the bladder? So a really simple thing you can do is to pop your colour on and see whether there's blood flow within it. So if there's blood flow within it, then it's got to be a mass. If there's no blood flow in it, then it's more likely to be a clot. So you can use that in combination with maybe passing a catheter and flushing over the area. Again, a clot you would expect to disperse. So that's a mass. So this is a bit more of an unusual case. So what you can see is me flushing in some saline around this spherical looking mass in the bladder. And what I was trying to do here was decide where this was attached to the bladder wall, again, whether this was something that was surgically accessible. And it was attached somewhere in here, so near the body of the bladder. So in my mind, this was something that was that possibly was going to be surgically accessible. My next question was, okay, what is it? Let's get a sample of that. We don't want to FNA bladder lesions because of the risk of seeding through the needle tract. So what I did in this case, and what I quite often do, was to pass a catheter into the bladder. So I've emptied the bladder, and what you can see is the catheter being passed, and what I've done is located the catheter over the area of interest. So I know that I'm over where I want to take a biopsy of that. And then just apply some suction. So here's your catheter. You can just see some suction being applied here. And if you watch, you'll see it, cells being sucked off it. See it go? Yeah. So I was quite happy that I got some sort of sample from that. I'll just show you it again. There it goes. And this came back. This was the cytology report. And the cytology report was suspicious for a transitional cell carcinoma. In actual fact, I ended up opening this dog up, opening the bladder up, and it was a reasonably simple thing to remove. It was in the body of the bladder. I got some nice surgical margins, and the actual final histological diagnosis was a leiomyoma, which was a great outcome for the dog. So, and he actually lived without any issues after that, a full normal life. I think he lived to 15 years old. So, other things we see in the bladder, polyps are reasonably common. So this was a dog that had a chronic recurrent infection in the bladder. And what we found in this chappie was a polyp. Again, you can see I've been flushing some saline back and forth into this dog's bladder again, just to help identify what was going on. And then here's a more difficult case. So this is my last case, just to show you. This was an 11-year-old retriever that came in, and he was passing blood, and he was actually bleeding actively out of his penis. So he would pee blood, and then he would pee more blood, and then he would pee more blood. And this wasn't watered down blood. This was proper blood. So he was hemorrhaging, he was anemic, and this was life-threatening. And I scanned his bladder, and I thought, okay, what have we got here? Is this a mass, or is this a clot that we've got going on? It was quite difficult to see what was going on. I did pass a catheter, and you can just see some fluid just around here, just being flushed around the edges of it. And the long and short of it was that this turned out to be, this was actually a mass, and it unfortunately for him, it was a hemangiosarcoma. So yeah, not very good for him at all. So that just gives you a flavour of some of the things that we find in the bladder, and just some short tips and techniques for everyone. So I hope that was useful.